Greetings, colleagues from around the world. I'm Barbara Dossey, International Co-Director of the Nightingale Initiative for Global Health, and I'm speaking to you today from my home office in Santa Fe, New Mexico, in the USA.
And I'm Dr. Deva-Marie Beck, also International Co-Director of the Nightingale Initiative for Global Health, and I come to you from Ottawa in Canada. It's a pleasure to be with you to be introducing this Planetary Health virtual global conference for nurses and midwives, this innovative opportunity for nurses and midwives from across the world to be sharing their skills, their knowledge, their concern for planetary health issues. I'm remembering that Nightingale said that nursing is to change the conditions that preserve and restore health. And that's what these nurses from across the world are doing, nurses and midwives. Planetary health is an extension of what Nightingale envisioned for us.
Oh, when I look at how long we have been together, and let me say to colleagues out there, Diva and I are both Florence Nightingale scholars. And when we got together in the 90s and then coming into 2000, we wanted to find a way where we could focus on Florence Nightingale because we realized that history is one of the most important aspects of any profession. And so we created, with like-minded colleagues, the Nightingale Initiative for Global Health. We took the first four letters of Nightingale, NIGH, and that is the Nightingale Initiative for Global Health. So when we look at the legacy that we have, it is just extraordinary. And one of the things that is empowering about looking at history and reviewing is we're able to see the challenges that Nightingale had. And as we come in today, we are faced with the same things that she did. What we have that is different is that we have organizations, we have like-minded colleagues, we have a lot of scope and standards of practice, and we have protocols, and we now have the capacity with Zoom to connect and take the work further than we can imagine.
Indeed, indeed. Barbie, you're often sharing about how Nightingale combined her sense of spirituality and her sense of science. And clearly that's important for this conference.
And I think, speaking about that too, let me also say, because we reflect on that, is Nightingale's universal spirituality. She believed that it was important to acknowledge all world religions. In fact, she said that we put all of those different religions and their string in God's necklace. And as we were speaking about that too, her definition of God is a power greater than ourselves.
Uh, and she kept saying that we as nurses were responsible for helping nature, God, to look after people and to change the conditions, helping us to be healthy and to restore our health. That one of the things that I find very interesting about all of this, people say, well, Nightingale was only a bedside nurse. No, she was actually in the 1870s, she was writing about deforestation in India was causing floods, and that the floods were causing runs of outbreaks of cholera. 1870, she was already an environmental activist using the media that she had in her time.
And Nightingale, she was an administrator, statistician, and that's one of the things that it certainly can focus on too, is looking at its science and also this universal spirituality. And it's not an either or. In our work, we combine these. I think it's also exciting, and I am always empowered by the fact that Nightingale called her work her must. And so that's what you and I have tried to do in our work with the Nightingale Initiative for Global Health, is it is our must to
Indeed.
focus on her legacy and help empower our colleagues around the world.
Yes, well, and I'm guessing that a number of these nurses, we've had actually 100 nurses and midwives speaking at this global virtual conference. I'm sure that they experience that sense of must, and perhaps everyone watching has that sense of nursing. Nursing isn't easy.
That's
Nursing is challenging, and if it's your must, it's what you bring to make the world better.
And I would say Nightingale's voice is on the internet if you've never heard it. And she says, when I'm no longer even a memory, just a name, I hope my voice perpetuates the great work of my life.
The other thing to say is that my favorite quote from Nightingale is that she said, health is not only to be well, but to use well every power we have. And I'm sure she would have been in awe of the power we have now with virtual global platforms. Health is not only to be well, but to use well our global virtual platforms.
Colleagues, we are so excited that you have joined us in this very important conference.
We send our best wishes for this conference to be outstanding in every way.
Excellencies, colleagues, dear friends, very happy to be with you at this International Council of Nurses. Thank you very much for inviting me, and greetings from Geneva at the World Health Organization. Thanks for the opportunity to discuss with you these famous 3 planetary crises. Since we are all health professionals, let's start with a good diagnosis. And this is the diagnosis. We are confronting 3 major risks for our human health. One, the climate change. And the climate change will bring us extreme weather events, high temperatures, their immediate health impacts in terms of heat waves or related illnesses and infectious diseases spread. And of course, it will bring as well the jeopardizing, the putting at risk our health systems. The second crisis we are facing, the pollution. Think about air, water, soil contamination, and of course, not only that, they will be responsible for respiratory, cardiovascular, reproductive, and even neurodevelopmental disorders. You know, to add that 7 million premature deaths are occurring every year due to the bad quality of the air we breathe. And then the third crisis, and all of them very much interlink, the biodiversity loss. We are disrupting our ecosystem, and this is leading us to a reduced food security. We have therefore new zoonosis, and of course, mental health stressors. In addition to that, let's continue with the diagnosis, and then I will stop with the negative part of this. The planetary boundaries are already exceeded. You know that we have a framework which identifies 9 processes that are very critical for maintaining the stability and the resilience of air system as a whole. And at the moment, all are heavily perturbed by human activities. Let me repeat it, by human activities. Isn't this lack of wise in our side? We have now breached 6 of the 9 planetary boundaries, and those include climate change, the biosphere integrity, land system change, freshwater use, and novel entities such as microplastics, endocrine disruptors, nuclear waste, and nuclear weapons. All of those thresholds underpin the stability and Earth that we need, and of which human health will depend heavily. The health and well-being impacts now, since we have the diagnosis, then let's look at how this specifically affects our health. And it's affected, of course, on our physical health. We will have increased incidence of heat stroke, vector-borne diseases, of course, malnutrition, as I mentioned before, air pollution calling all of these dramatic figures, 7 million premature deaths annually. We will have a very negative as well on mental health through eco-anxiety, massive displacement, grief over ecosystem loss. Vulnerable populations will be very much affected. And you know that children, older adults, and of course pregnant women, low-income countries and communities are the ones that are disproportionately affected. Let me give you an example. If we have deforestation, that will reduce the biodiversity. This reduction of biodiversity will promote zoonotic spillover, and this will increase the risk of a pandemic. Another example, very concrete, if we have an agricultural runoff, That will lead as the cause of water quality impacts, and therefore we will increase diarrheal diseases. Let's now work on something more positive and what is our role in our leadership and responsibility. And of course, you, the Nurse Council, what is your role? And I see many roles for you. Of course, on advocacy, we want you to champion the policies for clean air. Very recently, we have a very strong global conference on air pollution and health in Colombia. Many commitments were made, so we need your voice on clean air, on renewable energy, on sustainable food system. And this is just as well examples of what we are doing, for instance, on the implementation of air quality guidelines on at the urban environment, working with mayors, making sure that parliaments as well are changing the air quality standards. I see another fundamental role for you that you are already playing on education. We want to integrate all of these issues around planetary health into your nursing curricula. And of course, the continuing education. A well-equipped nursing profession, well-empowered and energized to safeguard both human and planetary health is fundamental. And of course, if you look at the recently developed WHO Air Pollution and Health Training Toolkit for health workers, you will find there something that I think is a very tangible, concrete, and specific example. We invite you to have a look at that. We need you as well on practical innovation. We need you on the development and implementation of low-carbon, resource-efficient health systems and care models. And I'm sure you heard about ATTACH, the platform on Alliance for Transformative Action on Climate Change and Health. This is a fantastic example where we are taking all the community of practice and reducing our carbon footprint as the health system. And we need you on engagement and mobilizing at local levels, communicate the risk, and build resilience. And now the final message, the call for action. Obviously, we would like to urge all nurses to see planetary health as an integral part to patient care and, of course, to public health. We would like to call you to collaborate across disciplines and sectors to drive this critical systemic change that we all need at the moment. And we need you as well, and this is my call of action to you, on reinforcing that protecting the planet is nothing else than a health imperative for now, for our current, but more importantly, for the future generations. So again, good luck with your Congress. Thank you for inviting me. We trust you 100%, and we have a lot of expectations on the role and the leadership you can play in this incredible challenge. Thank you very much.
Thank you and welcome. This is Dr. Teddie Potter, and you're going to get a more formal introduction in a little minute. But I wanted to be sure to thank Dr. Maria Neira from the World Health Organization, who recorded this message for all of us to help us realize that nursing can make a huge difference to restoring the health of the planet. But before we get started, I wanted to acknowledge, and all of us wanted to acknowledge on the Planning Committee, that planetary health is not new. It is an ancient way of knowing. It is a way of people living in right relationship with their environment. And our ancestors all over the world, indigenous peoples all over the world, knew and understood this relationship between our health and the health of the planet. So we wanted to begin this work, begin this moment and our talks with a piece by Stan Walker, who I won't say a whole lot more, but it brings in, an awareness that we are deeply, deeply appreciative of indigenous peoples living today and ancient indigenous peoples that lived in right relationship with nature that allows us to be here today. So thank you for listening to this important music. We are immensely grateful to Stan Walker for giving our conference permission to begin with his fabulous work and video. It is now my privilege to introduce ourselves to this conference. As I mentioned, I'm Dr. Teddie Potter, and I come to you from the land of the Anishinaabe and the Ojibwe people in Minnesota in the United States. And yes, it is still nighttime. It is just about 1 a.m. our time. So I greet you and say welcome, and I hope you're having a nice afternoon, all of you in the Western Pacific. I also wanted to say that it is a very, very special day for many reasons. We're hosting this conference, but it is the birthday of Dr. Heidi Honegger Rogers, and I want to be one of the first in the world to wish her happy birthday today, and that she actually showed up on her birthday to present to all of you. So, welcome to this sort of bold new initiative. We're the first conference to host a live round the world webinar that we're aware of. Everybody keeps saying that we're the first one, so we'll claim that. And it's just our joy to be here. The next few minutes I'll be doing a presentation, and then Dr. Rogers will come in and do her presentation, and then we'll have plenty of time for questions and answers and be able to engage you with that. In truth, I would love to be sitting and having a cup of tea with you right now, looking in your eyes, hearing your stories, and I hope one day we can perhaps connect in that way. But until then, it's wonderful that we have this way of connecting our globe together. Thank you for being here today. Dr. Rogers, it's your turn.
I think I got moved out. Oh, there we go. Yes. Hi, everyone. I'm Heidi Honegger Rogers, and I'm coming in from Santa Fe, New Mexico, in the land of the Tewa people in the southwestern part of the United States. I am thrilled to be here with you all. This is really an incredible way to start my birthday, so thank you for that. And really an incredible way for us to gather together as nurses for Planetary Health, for each other, for nursing as a profession. I'm really looking forward to hearing all of our panelists today, our presenters, and so just thank you, and welcome.
So I'm going to start by describing a little bit about planetary health. Some of you work in this space, some of you are directors of planetary health programs at your schools, and some of you have just heard the term for the very first time. So this first little presentation is to bring us all together and on the same page. And nothing has brought us all together and on the same page than the recent shot of our home that was taken by the Artemis crew that was just recently flew around the moon. And I don't know if you had a chance to be as moved as I was, but when you get out away from our planet and all the boundaries disappear, all the national concerns and struggles are not evident, it's just our beautiful planet filled with beautiful and incredible life. And as far as we know, it is unique in the universe. And so to see that, to be reminded of that, is the starting point for today. As I mentioned, when I talked about introducing Stan Walker's presentation, I want to acknowledge that humans once understood how to live in right relationship with the rest of nature. And so indigenous peoples hold a very, very special knowledge and way of being and way of walking through the world that we need to pay attention to. This is the Western Pacific Regional Conference, and so I have pulled up here all the various indigenous peoples in this region of the world, and I celebrate and honor what they have to teach us and share with us. Indigenous peoples represent 5% of the global population, yet they protect over 80% of all of our biodiversity, and therefore need all of our support and respect and appreciation. So these are the countries in your region. These are your neighbors. I zoomed out to the planetary level, but if we zoom in to the hemisphere level, these are all the people in this WHO region. And you have shared crises. So this is the color stripe that demonstrates how temperatures have changed over the years. This happens to be the colors, my colors stripe for Fiji. And if you look at it, their average annual temperature was in the blue zone until the last few decades. And you can see when fossil fuels started to be burning, the Fiji became warmer, 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 and now it's in a very, very dangerous spot. Look at the biodiversity loss. This particular shot is of the coral reefs that are at risk of bleaching. And many of those reefs are in your location, are in the Western Pacific, in the danger level of level 2. And look where plastics are produced. Again, many of the plastics originate in the Western Pacific production area. So you heard Dr. Neira mention these planetary boundaries. The Stockholm Resilience Center and the Potsdam Institute for Climate Impact Research have determined, the scientists there have determined that there are 9 planetary boundaries. Now, nurses are aware of systems. If you think of our human body has endocrine system, the pulmonary system, the cardiovascular system, renal system, etc. And all these systems work beautifully together, are all interconnected, all related to one another. And if they're functioning well, we have health and we have life. But when they start to break down, we begin to have significant problems. We can deal with perhaps one of those systems going down. We can be put on medications or treatment plans if we have the renal system starts to fail. But when you have the renal, the cardiovascular, the pulmonary, when all these systems start to collapse, at some point, if we cannot treat the conditions, life no longer is possible. The earth functions the exact same way as our human bodies. It has 9 systems that are interconnected and depend on one another to be healthy and in balance. These 9 systems are called the 9 planetary boundaries, and they include change in biodiversity. Now we're having a biodiversity or loss of biodiversity that's 1,000 times the normal rate of extinction. So let me say extinction is not abnormal. Things, species come, they go, they develop, they disappear. That's not abnormal. It's evolution. It's the process of life on this planet. But right now, the process of beings disappearing and becoming extinct is 1,000 times happening 1,000 times faster than normal. And that's the concern about biodiversity loss. Our land system change. Areas that were previously forested have now been cut down to provide additional farmland for our foods. And so we're having deforestation. We're also having places become desert because of our transformation of our land. Fresh water, we're running out of water. There's a limited amount of water on the planet, and we can only, if we pollute our water, we have less and less to drink and use for maintaining life. Geochemical flows has to do with phosphorus and nitrogen. There's naturally occurring phosphorus and nitrogen on the planet. But because of our use of fertilizers and other chemicals, we are disrupting those natural levels of nitrogen and phosphorus. Ocean acidification. The ocean, just like our bloodstream, I remember teaching this in nursing, our bloodstream can only be in a certain range of acidity and basic balance, the acid-base balance. I'm sure all of you students just love learning about acid-base balance, but it is really essential to maintaining life. When you're too acidic or too alkaline, your body cannot do what it's supposed to do. Similarly, the earth is the same. The oceans are the same. They cannot tolerate being too acidic or too alkaline. Um, uh, excuse me, aerosol loading, that has to do with pollution of our atmosphere and air pollution, etc. Stratospheric ozone depletion, there is an ozone layer that protects us. And there once was a hole in the ozone, and I'm going to get to that in a minute. Introduction of novel entities, as Dr. Neira said, that has things to do such as radiation, antibiotics, microplastics, and then climate change. When you hear people talk about climate change, sometimes they stop there and they speak as though that's our only problem. It is not our only problem. All of these 9 issues, as I said, work together and are interconnected. So we need to be aware of how we're damaging all 9 systems. And last September, the 7th boundary was breached or crossed. 7 of 9 boundaries are in the danger zone. If you had 7 of 9 of your systems in your body being destroyed, you would not be able to live. And the Earth is in a similar spot in its ability to support life. We are in a very dangerous and critical space. But I want to give you a little hope. Look at those 2 pieces of pie that are gray, stratospheric ozone and our aerosol loading of the atmosphere or pollution of the atmosphere. Because humanity came together, because around the world we developed policies and laws to rein in the chemicals that were destroying our ozone layer and to bring down pollution of our air. We were able to move it back into the gray zone. And that is possible for all of these different sectors. And that's why nursing is needed, is when nurses show up, things get done, and life is restored. So humans are causing the planet to change. This is not just climate change. I want to be very clear about that, because if we only focus on climate change, we're going to miss these other problems and the underlying drivers of these other problems. So forests are being cleared, biodiversity is being lost, oceans acidifying. We've talked about that. Land is becoming desert. Soil, air, and water pollution, rivers are drying up, extreme weather events are harming communities, and there was just a super typhoon in your area. So we pay attention, even on this side of the globe, what's happening to your side of the globe, because this is all interconnected and we're all causing these terrible events that are leading to loss of life and impacting health. Temperatures are increasing and sea levels are rising. This is in your area, the Western Pacific, the Marshall Islands, and this is just one example. But as the temperature of the planet rises, sea levels, the ice at in Antarctica and Greenland are melting, and because of that, sea levels are rising. We say 1.5 to stay alive, and that means a lot to the island nations, especially the island nations of the Pacific and the Indian Ocean region. This is not some arbitrary, far in the distant future issue. This is real people, real neighbors. These are your neighbors having to relocate, move their cities and towns, and in some cases, their entire islands are at risk of going underwater. And that's just at 1.5. We're at, I believe, 1.2 degrees centigrade right now. And according to the most recent Congress on the Parties or our UN COP conferences, we're likely to exceed 2.0. And all of this has human health impacts. That's why we as nurses have got to pay attention. This is not something that's separate from us. This is the work that is important to us. All of the things I've mentioned lead to these problems that you see on the screen. Cardiovascular diseases worsen, respiratory diseases exacerbate, infectious and zoonotic diseases and diarrheal diseases occur. We have antimicrobial resistance, dioxin and toxin exposures, heat strokes, mental health effects, malnutrition, forced displacement, migration, and civil strife and trauma. All of this is increasing. So this is a picture of how the planetary health system works. There's underlying drivers that lead to environmental changes. Those underlying drivers or upstream issues include cultural behaviors, values, patterns of consumption, the size of our population, demographic shifts, and yes, many of our technologies that we think are going to help us or save us sometimes lead to bigger problems. These cause these shifts in the 9 planetary boundaries, which then changes or leads to proximate causes of health problems. All of these then have modifying factors that eventually lead to health impacts. And I showed you in the previous slide the health impacts. The modifying factors, some people call them structural determinants of health or social determinants of health. It's things like socioeconomic levels, race, ethnicity, patterns of governance, social relationships, built environments, etc. Depending on those factors determines how impacted people are by shifts in our environment. For example, if you have a large amount of wealth, you might be able to live or choose to live in a place or move to a place with better air quality or lots of fresh water available, fewer exposures to infectious disease. But if you're in a place with fewer resources, that might not be an option to relocate to places with clean air. There might be more factories or places that spew pollution in your neighborhood or in your community. So all of this works together to create the challenges of intersecting our planetary health and the health of humans. I have put stars by, and I think, let me just see here. Yep, okay. I have put stars by the areas that nurses can be involved in. Obviously, we care for people who have disease states, infectious diseases, nutritional diseases, non-communicable diseases, all of those things. We are involved in caring for people and communities with those challenges. But we can also be involved in addressing the social determinants of health, the structural determinants of health, and all those modifying factors I discussed. But most importantly, I hope we get involved way upstream in helping people recognize that human behaviors are the root cause of the problems we're facing today, and that we as a global community need to address the behaviors that are leading to this problem. The Rockefeller Foundation Landsat Commission on Planetary Health said in their report of 2015, we've mortgaged the health of future generations to realize economic and development gains in the present. And yes, that's exactly what we've done. So Take a deep breath. That was the tough part of the talk. It's the scary part of the talk. It's very, very scary to realize that our home, the place that we know, the place that provides our food, our air, our water, is threatened, and that our children and grandchildren potentially are going to struggle to survive. That is the urgent reality of now. But because of planetary health, we have an option to move forward towards a hopeful future. So planetary health is a relatively new term. It just came about in 2015 with the release of the Rockefeller Foundation Lancet report. But it is so it's a newer term. It's about 10 years old. Many of you are probably more used to the terms that you see on the bottom of this page: public health, eco health, One Health, global health, and the UN Sustainable Development Goals. Planetary health does not replace those. All of those are important initiatives, and all of those have helped improve the health of humans and animals on this planet. But it's not big enough. It's the tent or the gathering is not big enough. What planetary health does is it brings all of those areas together, all of the people working in these spaces together, so that we can come up with the solutions that are necessary. So this is the definition of the planetary health by the Planetary Health Alliance. And I'll say more about the Alliance at the end of this talk. Planetary health is a solutions-oriented, transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems on human health and all life on Earth. So a couple things I want to tease out about this definition. Planetary health is solutions-oriented. We do not just sit around and study the problem over and over and over again. We are busy studying and working on and discovering and analyzing solutions. It's focused on solutions. It's a transdisciplinary field, meaning nurses alone can't solve this. Health professionals alone can't solve this. We can't solve it with a One Health approach necessarily, which is physicians, veterinary medicine, and environment. We need to include all fields, all people, and it's transdisciplinary. It's a social movement, meaning that we don't just know or learn, we get going and start addressing these challenges. And that it is human caused. We acknowledge that human behaviors got us in this mess to begin with, and human behaviors are able to pull us out if we work together. So this also, a key piece of planetary health is it's not just about human health, it's about all life on the Earth. We are concerned for the existence and life of all beings on the Earth. So let me say a little bit more about transdisciplinarity, because it's different than interprofessional, it's different than multidisciplinary, and it's different than interdisciplinary. Transdisciplinary means that we come together, we create a safe space for us to engage and not just learn about each other, but learn with each other and develop solutions that would not have been possible if we hadn't come together. So I like this metaphor of paint. If we brought a bucket of red paint, a bucket of blue paint, and a bucket of yellow paint together in the same space and created the right environment for those to mix, something brand new is possible. We would have orange, purple, and green because we had created this environment. The same thing is true for planetary health. We aim to create the environment where all disciplines, all people, all skills can come together to create new solutions that don't currently exist. We also, in order for this to happen, in order for a nurse to talk to a farmer, to talk to an engineer, we need to have a shared language because we each have disciplinary languages that don't necessarily interpret well to another discipline. So we needed a shared disciplinary language. And what we did is we came up with, we brought 24 experts from around the world, all from different fields together. And I asked, what do we all need to teach our students in higher education if those students are going to go on and be able to relate to one another and discuss planetary health? And these 24 experts suggested 500 things that we needed to include in our curriculum. Well, you know as well as I do, if you're a faculty, there is not space for 500 new things to teach. So we worked together until we could all agree on 5 core domains. These 5 core domains is our shared language. We discuss this and share this amongst ourselves. We talk about this. We use this language when we write, when we research, when we advocate, and when we lead. The first one is interconnection within nature. We have put it at the very center of this model because it is essential that we understand interconnection with nature. The second one is the Anthropocene in health. The Anthropocene in health means that these are human-caused problems, and to heal the system, we need to work with humans to change the behaviors that are the problem to begin with. These are not going to miraculously disappear with technology changes. We have to change human behaviors. Equity and social justice is essential to understand. It is not something that we add in at the end after we've done a hard day's work. Equity and social justice is one of the 5 core domains of planetary health because what it acknowledges is that not everything, all the pollution and causes are equal. Different people have contributed to our environmental destruction in different ways. And those that have contributed least to the environmental destruction are often suffering first and worst the problems of these that we have caused. So equity and social justice have got to be part of this model, part of our teaching, part of our actions. We can't just come up with solutions that work for 1% of global population. They must work for all people. Systems thinking and complexity. It is complex, just like the human body is complex. We need to recognize that the planet is complex also. So we have to have systems thinking, because if we try to solve some of these problems and you come up with a great solution over in one sector, it might have terrible unintended consequences for other parts of the system. So we need to be engaged. We need to be talking with one another. We need to be very strategic and very purposeful. And when we come up with something we think is a solution, we need to look at the entire system and how the entire system will be impacted. So we have to have our young people and our people that are educated right now understanding systems thinking. What is systems thinking? And why is understanding complexity so essential? And then movement building and systems change. It is not enough to just know. We've got to get activated. We have to be in networks, supporting one another and working together. So this whole model is designed to be like braided strands of a rope. The center of this rope is this interconnection within nature. It is not that humans are over here and nature is over here and we're separate and that we need to reconnect to nature. That is an old story. And that old story of humans being separate from nature led us to think we are better from nature, we are more important than nature, and we could do anything we wanted to the rest of nature as long as we benefited. That old way of thinking has got to disappear. We have to return to indigenous understandings that we are nature. We are absolutely, humans are absolutely part of nature. What you do to nature, the rest of nature, you do to ourselves. Until we grasp the importance of being humble in the presence of the rest of nature, we will not be able to make this. So that understanding's at the core of our model, and around it are these other 4 domains, and it's like a rope. If you took a cross section of rope, this is what you would be seeing. So that's our shared language, 5 domains. I can talk to anybody around the world who's a planetary health practitioner, and they all understand the 5 core domains. But we also need to have a shared vision, and the shared vision is the Sao Paulo Declaration on Planetary Health. This was published in 2021 when the world needed to come together for a virtual conference because of COVID. So we crowdsourced what does the global planetary health community envision for a future that's life-giving and where life is flourishing. And that was the Sao Paulo Declaration on Planetary Health. It states we need a fundamental shift in how we live on Earth, what we're calling the Great Transition. And achieving this great transition will require rapid and deep structural changes across most dimensions of human activity. That means that we've got to get going. There isn't just one sector that's going to solve this. The conservationists and biologists are not going to solve this. Everybody has to come together with their skills, their knowledge, and their abilities to make this happen. And the Sao Paulo Declaration provides guidance for all sectors. So there's guidance for city planners, there's guidance for researchers, for people in governance, for agriculture, for people who work with animals. There's guidance for all the sectors, and this is the guidance for us. This is what the global community is calling us to do. We are supposed to reorient ourselves towards planetary health, to move from everything we do, from procurement or our purchasing of supplies and products, to our energy that we use, to healthcare efficiency, to waste reduction. And we need to commit to be nature positive, carbon neutral before 2040. We need to move towards resilience of resilience of health systems, even in the midst of these changes. Reorient towards disease prevention and health promotion, and away from just being an illness care system. We need to encourage health equity, and it has to be at the heart of this transition. Global health equity, might I say. We need to incorporate the health perspectives and traditions beyond Western ways of thinking so that we include traditional knowledges led by indigenous peoples, as well as other integrative health practices. A shout out to the Holistic Nurses Association and the multiple layers of sponsorship that they have for this conference, in that we are moving more towards integrative health practices as a planetary health approach. We need to affirm the importance of public and active transportation, healthcare, access to health facilities, green spaces, air, soil, and water quality, nutritious diets. And we need to advocate for culturally appropriate health services as a basic human right for all people. That is what the globe is calling us as nurses to work on. Our most recent document in Planetary Health is the Planetary Health Roadmap and Action Plan, which was released at the Planetary Health Annual Meeting in Kuala Lumpur in 2024. This action plan takes the 5 core domains and the vision of nursing in the Sao Paulo Declaration and gives us a roadmap on how we get to that vision for the future. It particularly underscores the importance of looking at global governance, education, business, and how we communicate changes around the world. The Planetary Health Alliance is our global unifying organization. It was started right after the publication of the 2015 Lancet, Rockefeller Foundation Lancet report, and the Planetary Health Alliance is made up of over 500 organizations, large organizations, many individuals in 80 different countries. And all of us are working towards this vision of the future, this great transition of how we will restore planetary health and the health of all peoples and all life on the planet. The Planetary Health Alliance is one of the sponsors of this conference, and many of our speakers in the later sessions have been provided or are connected to the Planetary Health Alliance. The Planetary Health Alliance has many resources. Even if you're not a member, these resources are all available to you. They're all open access. It has coursework, syllabi, lectures, videos, case studies. The latest research is published there. It also has a newsletter you can sign up for so that you can get connected to the rest of the planetary health movement around the world. But I wanted to call attention under education and research. We have 3 videos that highlight the global nature of planetary health. And in these videos, people from around the world describe personal experiences of what they're encountering, their awakening to an understanding of planetary health, and success stories. So I invite you to take a look at those videos and use them in your classes. If you're a teacher, share them with your communities if you're a community nurse, but recognize that you're entering a large global movement to create a better future for everyone. So here's a QR code. You can, if you have a cell phone, you can pull up the QR code. Otherwise, here's the link for the Planetary Health Alliance, and we urge you to become a member. It does not cost anything to become a member, and it allows you to connect to this global network of people and programs and organizations that are all working in this space. I would like to close by saying, showing this picture. I started out with one of the first images shot by the Artemis space crew that just came back from the moon. And this picture was also taken. This was taken on April 6th. And this quote was by one of the astronauts. And it affirms what we are saying in planetary health and what we believe and why we feel so strongly. We will always choose Earth. We will always choose each other. I'm going to say that again because I think it's a pledge we all need to commit to. We will always choose Earth, and we will always choose each other. Here are my resources. These can all be accessed on the Planetary Health Alliance, and I look forward to your questions or comments after Dr. Rogers gives her talk. Thank you.
Oh, that was great. Teddie, I always love listening to you give this talk and bring us together in our shared understanding of planetary health and how we are going to be moving with that, how we are currently moving with it as nurses and nurse midwives. So let me just go ahead and share my screen, and I'll talk to you about nursing for planetary health and well-being. All right. Hello, everyone. So after we learn a little bit about, planetary health and the scope of planetary health, what's working, what the Planetary Health Alliance is doing, I want to take this second part of our introduction to this conference session today to just talk about who are we and how are we moving as nurses and midwives in this work of planetary health. And of course, there's a theme. I love that both Teddie and I pulled up and put pictures of our beautiful planet that were recently taken from the Artemis 2 mission from NASA. And hopefully these are images that went around the world. I'll be curious. We were stuck to the NASA channel, our Aeronautics Space Administration channel, the whole time that our astronauts were up circling the moon just a few weeks ago. What I love about this photo is really, this is a good reminder that we share a home together and that our home is small and precious in this vast universe of ours. I think reminding ourselves that, when we live on the planet and we are at human scale, we think, oh, the planet is so big. But when we really look at this picture of the planet from outside, we realize that we are together uniquely on a shared home. So hopefully these images help people start to remember how much we are interconnected together. And I have this here. I love thinking of, thinking about the earth and the earth's crust and the bedrock of the earth. And I think of nurses and midwives as the bedrock of our healthcare systems, our healthcare sensibilities. I always like to remember that we are 29 million nurses and 2.2 million midwives globally. We comprise almost half of the global health workforce. And we, as nurses and midwives, deliver the majority of primary healthcare services worldwide. We are very connected as nurses. We are very powerful in the work that we do to advance the health and well-being of all of our patients, their families, their communities, our communities. So nurses and midwives, hang on, I need to move this. Nurses and midwives have been responsible for advancing public health and population health. We have shown up in disease prevention to lead vaccination campaigns that have eradicated smallpox. We've been on the front lines in polio, tuberculosis, and HIV and AIDS. We have been working in maternal and child health, midwifery, expansion, and the amount of midwives that we have and that we continue to need can prevent 67% of maternal deaths globally. We are doing incredible work in these areas. We are health promoters. We do community education on nutrition, on sanitation, on chronic disease management. We are also emergency responders. We were the backbone of the pandemic response, both in 1918 influenza and also COVID-19. And we are the people that are really working toward and advancing health equity. We bridge gaps in rural and underserved and conflict-affected populations. We are uniquely connected. We are uniquely doing amazing work here on the planet. So at the beginning of our talk, you saw a video by Barbie Dossey and Deva-Marie Beck. We were talking with Deva-Marie just a month ago, and she said, nurses and midwives, we are the vanguard of what humanity can and must become. And I thought, I got to quote that and put that into our talk as we're bringing in these amazing, you all, amazing beings coming together to talk about these new, wicked, complex problems. So she expanded on her quote to say, across the world, nurses are exemplary for caring, compassion, commitment, and courage, the attributes that humanity needs. We have demonstrated these with our sick nursing, and now we can demonstrate with our health nursing. The power of our public voices can be heard, listened to, and respected for the value of our perspectives as role models for health and humanity. Thanks for the hearts and the celebratory gifts, I guess, that you all are putting up. I see those. So we are in a unique time. Teddie mentioned in the Sao Paulo Declaration the idea of the Great Transition, and I think it's important to really think about this as linear time. Where are we? What is going on? I know, we all know, and we're experiencing new and very worrisome signs and global news, and where you are, today is being impacted by what's going on geopolitically in the world, and what's going on with Planetary Health. And it feels for me, and I'm guessing it feels for all of us, slightly overwhelming. I have always I was introduced to this two loops model actually through a Nursing for Planetary Health working group that gathered several years ago, and this model really helped me think about, how do I talk to my kids? How do I talk to our students about where we are in time and what it is that we're doing as nurses? So the two loops model follows just a natural nature cycle model. The dominant, it actually started out thinking about, plants and crops. The dominant forces grow, they reach their peak, they naturally disintegrate and pass on. As that is happening, new forces germinate, innovations, they connect, they start to build and grow, and the great transition, which is what what the Sao Paulo Declaration is talking about, starts to happen. And we are very specifically at this point, towards the end of the dominant cycle and towards the very beginning of the emerging systems. So we, as nurses, we're seeing ourselves in both the disintegration. We've witnessed firsthand how many of our systems, and very specifically our healthcare systems, are not in service to the health and well-being of the populations that we are caring for. We're seeing that some of the ways that we had been doing things are no longer working, that there's too much pressure on the way that we have designed our healthcare systems, and that we need to rethink how we work in nursing, how we work in healthcare, how we think about the sensibilities of health and well-being. And those are the systems that we as nurses are imagining and creating. So, hopefully this image resonates as deeply with you, as it does with me. Just to narrate, we're seeing all sorts of things that are, we're witnessing these many problems, these worries that we have. And at the same time that that's happening, we are also witnessing incredible imagination, deep caring and compassion, and really a resurgence of nursing, of the practice of midwifery, and how we move as nurses and midwives in our caring and compassion to address these new complex wicked problems that we have ahead of us. So the great transition really is asking for, and Teddie mentioned this quite a bit, and this really is the core of what we're talking about with the solutions-oriented nature of planetary health. Is the great transition is asking us to move and live differently, to think about how we live together and how we live in partnership with all of our ecosystems, how we construct and live in our cities, how we manage and work with our natural landscapes and resources, how we design our healthcare systems and our sensibilities. We need to be thinking about how we really produce and consume food, how we manufacture products, how we work with energy. This is the creation of the planetary health movements. These are the policy shifts that we need as nurses to help love and support into being. And these are the stories that we need to tell ourselves about our place in the world, our relationship to nature, our connection together on this beautiful and precious home that we call Earth, and what it means to really live a good life. So that's what we're talking about when we're talking about the Great Transition. So I probably don't need to remind you of what we do in nursing and midwifery, but I wanted to think about, who are we and what is it? We all practice in different areas, right? But when you really look out at what we're doing in nursing and midwifery, we are working in specialized healthcare teams around the world. We are doing primary care leadership. We're in independent practice, many of us. We are in emergency and response care. We work in interventional care and support. We work in palliative and end-of-life care. We're doing community and population health. We're also leading in technology and innovation. We're working for mental health and well-being. We're doing digital health and remote monitoring. We are working in crisis. I know many of us here have been working in humanitarian responses and crises locally and around our regions. As nurses, we are really task shifting. We saw that in COVID, how we showed up to work and our job shifted and changed because of what was happening in the world, and I think, or what was happening, to our patients and our communities. So we're task shifters. We are disaster responders. We are working in very, very importantly, especially here in planetary health, preparedness and resilience. And we are doing leadership and advocacy. It's not just, folks who are in charge of things. Every single one of us is leading by showing up in the work that we're doing. We are doing a lot of health system leadership. We are doing a lot of global health advocacy and policy. We're also educators, and we're mentoring the next generation, and we are engaging with our communities. So it's just cool what we're doing in nursing and midwifery. So Teddie talked a little bit about the social and structural determinants of health, and I wanted to put together this slide to really remind us of all of the determinants, the combined determinants of health and well-being that we are moving and working with as we're engaging with our patients and our communities. So I think I'm guessing we're all pretty familiar with this idea of like nesting systems, expanding determinants of health. A lot of our healthcare systems, particularly, the ones that I'm seeing in the US, we work on very specifically and mostly individual determinants of health, where we are counseling patients one-on-one about their exercise, their diet, getting enough sleep, drinking enough water, managing their stress. Those are some of the individual determinants of health. We're starting to work more deeply, I think, in nursing and in health in general at the cellular level. So how our microbiome is influencing our health and well-being, how our genetics and our epigenetics, and also our exposures, our environmental exposures. So there's whole new fields that we are moving in as nurses and midwives in this area. And then we've got our stacked social and structural determinants, right? Our immediate environments, our social networks, how that influences our health, our mesosystems, what our belief systems are, the norms in our cultures and our communities, our family views and values. Those are kind of the added layer of like how our health is determined. And then we've got, a little larger layer, our exosystem. These are more of our structural determinants, how our infrastructure works, our public health infrastructure, our transportation infrastructure, our, just how does our water systems and our and regulation of water and air and exposures work. And then our bigger systems, our macro systems, these are some more of our geopolitical determinants of health, our laws, our economics, as we all know, really determine our health. And then these chronosystem layers, which wrap all of it. You remember that Teddie showed that picture of a arch, and she talked about planetary health as really this big overarching way of thinking about what is determining our health. And so this is sort of that kind of picture as these planetary scale ecological determinants of health. So to that end, the Planetary Health Alliance has made this image to help us, I think, in healthcare and certainly in nursing and midwifery, to think about what does that chronosystems, that larger systems way of really understanding these planetary scale determinants of health look like. And of course, I love that it's our beautiful earth, a heart in the center. This is the work that we are doing in nursing and midwifery to address and work on the health impacts. And then it's connecting how we as humans are causing these planetary scale problem sets, and how that is coming back to interfere with our health and well-being. So just another way of thinking about this work and a way of thinking about how do we communicate about this work as we go forward. So, just to reiterate the resources at the Planetary Health Alliance, which are freely available for all of us to use as we're working in our communities. And just, to remember, Teddie introduced this model. The red on the right is, where we are very specifically working, but as we are thinking about how we are working toward solutions in these areas, we can go back and look at what are the modifying factors. How can we reduce and mitigate the proximate causes? How can we help our communities with, reducing exposures to environmental toxins is just one of many examples. how do we help our larger communities reduce the amount of greenhouse gases, of air pollution that we're collectively producing, so that we can lower our risk of health impacts from climate change, those kinds of things. And then how can we as nurses and midwives move with these ideas of addressing these underlying drivers? What are the stories that we're telling ourselves about our values and our collective home and our work together as a global community? And how can we start to narrate and support that work in nursing, which I'm going to talk about. All right. So the first thing that we really need to be doing as nurses and midwives is improving our own environmental health literacy, right? So, we all, I'm going to say probably 9 out of 10 of us did not learn this material when we went to school. But I do know that a lot of us are teaching this material to the next generation of nurses and midwives. And so improving our own environmental health literacy is really just recognizing what are the local sources of pollution, the local impacts of climate change, the local ways that things are working and how that's impacting our health, understanding those health harms, educating, just starting to educate ourselves and our patients and our communities about how to reduce those harms, and then working together to advocate for mitigation, which is the word that we use, or that I use, to talk about how we actually start to lower exposures and lower risks. We are also working in resilience, and I think that's one of the most important things. Well, it's all important. Everything we do in nursing and midwifery is important, but we are working with early warning systems, so paying attention. Teddie Potter always says, nurses are always looking at patterns and seeing when signs start to show up that something is wrong. Those are we have a keen sense as nurses and midwives to see how stuff is shifting in our communities. Very specifically, we work in early warnings, we work in infrastructure, thinking about how are we going to prepare for the next the next disaster or problem. How are we going to attend to the mental and physical health of our communities? And how are we going to start to connect our local community responders, all of the different disciplines that need to come together in our communities? So this is work that we need to be doing in nursing, that we are being asked to do, and that many of us are already doing. We are also working in food and nutrition. We are doing, and we need to continue to be thinking about this. How do we, one of the big areas in planetary health that we're discovering is so hard on the planet is actually how we grow our food globally. There are a lot of unsustainable practices, and if we can help our patients and our communities understand the importance of plant-forward diets, so eating more plants, growing more plants, trying to have more diverse supply chains, so that we each community has more local access to food that's grown locally, with layers of food, and supply chains that help to support and feed people. I think one of the biggest things that we're worried about as climate is changing is ever widening areas of food scarcity and water scarcity. So thinking about how are we going to, working in advance of that problem set as nurses and midwives and community members. How we support regenerative agriculture and food redistribution, and how we help to ensure that folks in both urban and rural areas have access to sufficient nutrients. We're also doing clinical interventions. We're thinking about how do we help our patients and our populations reduce the health impacts from extreme heat, from vectors, new and changing vector-borne diseases, from shifting water safety and water quality as the environment is shifting, and also how we try to address the equitable distribution of care and access to care. Teddie went through the Planetary Health Education Framework. We work a lot in education. And so just to remember that we are also educators as nurses and midwives, maybe not necessarily formally in a nursing school, but I know many of us are working in those environments, but we're always mentoring the next generation of nurses, and we're educating our communities. In nursing for planetary health, the Planetary Health Education Framework, when you read it, which you should do, it's really a beautiful document. There are, each of these communication areas has very specific ideas and narratives around, what is this shared communication? And so, in this idea of interconnection within nature, which Teddie also talked about, this is thinking about how do we come together with this idea, and how do we work with the next generation of our students, and how do we work with our communities to understand that we are not separate from nature, we are nature. And in that kin centricity, which is a word that we use a lot in the US, that our indigenous communities here talk about, this sense of sisterhood. I'm going to call it sisterhood. It could be brotherhood. It could be, just this connection of family, that we are all together as family. And those are the key kind of ways of thinking about interconnection within nature. Yeah. And then what we're talking about in the Anthropocene and health is most of what we've been talking about in these conversations today. Boy, talking in the middle of the night. Hang on, sorry. How we narrate these social and ecological determinants of health, how we start to manage and think about conflicting worldviews and globalization dynamics. And, these are the kinds of things that we need to be teaching and learning about, and continuing to center in the work that we're doing as nurses. In equity and social justice, which, I think nurses and midwives and have always, we always hold this in the center of our heart. What is fair? How can we make sure that everyone in our community has the access to what they need for health and well-being? So it's probably, this is just a core of what we do in nursing, and it continues to be something that we need to be talking about as we are educating the next generation. Systems thinking and complexity is our skill set in nursing. We are really good at looking at systems and thinking about how do we make these systems align with our patient values. We need to be even better as we, as I was kind of showing you that two loops model, as we are really working toward imagining what the systems of the future that are in service to the whole health and well-being of all of us and all of nature. As we are imagining that, we need to be thinking about how do we shift and move the systems that we have, the systems, some of which are breaking and probably will continue to break, and how do we build out the new ways of doing things. The new old ways probably is even better way of framing that, to get to where we need to be for collective flourishing. So really thinking about how do we teach this? How do we talk about it? How do we really work in it? How do we practice it? How do we embody systems thinking as a way of moving in everything that we do? And then movement building, which is the thing I really like about planetary health in general for me, is it's not just about studying what's going on, or what's going wrong in the world, but it's thinking about how do we as nurses and midwives join all of the other professions and kind of following the Sao Paulo Declaration, join with everyone else in these partnerships to shift those root underlying drivers that we looked at in the planetary health model. And so that is a skill set. I was talking to somebody the other day and they said, what is your what's your why or your must in nursing? I guess that was Barbie Dossey that talks about your must in nursing. And I think for me, so I'll make this as my birthday wish today. If we never, ever, ever heard the word just before we said the word nurse or midwife, right? I hear that so much from students. Oh, I'm just a nurse, or they're just a nurse. We are really, I think, I mean, I'm so nursing, feel like I love nursing. But just thinking about us as real movement builders. Yeah, I think everyone should put hearts into the chat for that one. Let's take just out of any of our languaging as we talk about the work that we're doing in nursing. Yeah. Yes. Yay. All right. So in addition to our practice and our education, we are also, many of us, moving in advocacy and policy. And so these are just some of the examples of how we can move in advocacy and policy, how we're paying attention to what's going on in our communities and figuring out the ways that we can help to support what needs to happen going forward. With that, I want to say, I think one of the things that we all experience as nurses and midwives moving in the work that's going on around the world now is we're working hard, right? I know every single one of us goes to bed exhausted at the end of our work days, and that's not what we need. We don't need more work on top of the work that we're already doing. We need to be thinking about how do we move with the work that this movement building, these sensibilities, these skills of planetary health, and how do we do that inside of the work that we're already doing in nursing and midwifery. So it's going to look different for each of us. And not everyone is moving in advocacy and policy. But a lot of us are. And so you want to think about, how do we educate our individual patients? How do we work with community organizations to share the stories that need to be shared so that we can start to co-create the kinds of policies that need to be co-created to establish, to really move to flourishing. So to that end, there is a global organization called the Alliance of Nurses for Healthy Environments. And there's a lot of really neat resources and ideas. And I will say it's a global organization. It's definitely very US centric, just because it was started here, and I'm sharing it with you because I am from the US and I know about the work that the Alliance of Nurses for Healthy Environments is doing. But again, joining is free. The resources are amazing. You can listen to podcasts of work that folks are doing, what a lot of nursing students are working on. So that if you haven't dipped your toes into policy and advocacy, the Alliance of Nurses for Healthy Environments is a good place to start. We're also working in research and scholarship. So, I made a couple of slides to talk about what is the research and the scholarship that we need to continue to advance as nurses and midwives. So very specifically around the health impacts of climate change in our local communities, how that is disproportionately affecting different populations, more vulnerable populations. We need to be thinking about the mental health impacts of climate change, and researching on that, and working really toward not just identifying it, but how do we help particularly our young folks really move with existential dread that I think a lot of I don't know that I can speak globally to this, but I feel like in my experience, there's a lot of that with our next generation of my kids and also our nursing students. But there's some research that needs to be done on how we can move with that in nursing and midwifery. We need to be continuing to look at all of the different novel chemical entities and the various kinds of pollution and how those are impacting our health and well-being. How occupational exposures are increasing risks. So, I talked a little bit about this, patterns, looking for patterns. We are always doing that. Not everyone self-identifies in nursing and midwifery as a researcher, but if you think about research as noticing, and starting to communicate what we're noticing and patterns that we're seeing, and you just take that very simple definition, you could consider all of us as having a responsibility in nursing and midwifery toward storytelling for what's happening, what's going on, what we're noticing, and how we're sharing that out into the world. So, things to think about inside your workday, not on top of it. And then also biodiversity loss. This is one of the big areas that we really need to continue to advance our understanding in. How how loss of medicinal plant knowledge is impacting the health and well-being of our communities is a really good example of work that nurses and midwives are doing, that continues to need to have more of us thinking about and working on. And certainly around the ecosystem degradation and its effects on our nutrition, our food security, our community health, zoonotic disease or zoonotic spillover risks from habitat destruction, how that's impacting our health, those kinds of things. So this is sort of a summary slide on the cross-cutting research priorities and, and how and scholarship, right? Like, how do we build out these systems that we need to build out? So just thinking about, as research and scholarship as storytelling and collective gathering of wisdom and putting that all together. So the other thing that we do is leadership. I mentioned this at the beginning of the talk, and one of the things about what I like to, when I think of myself as an educator, which is primarily what I think of myself now, is as I work at the University of New Mexico, is I am facilitating in my education practice. I'm facilitating the development of the next generation of nursing leaders, right? Each of us in nursing and midwifery are showing up for the work that we care about. And that is our leadership. I think, I don't know if this translates completely globally, but for us, for me, I always, I hate it when I hear, not just putting just in front of nursing, but I also hate it when I hear somebody in nursing or midwifery who's saying, I'm not a leader. We're all leaders because we're showing up for work that we care about, and we're bringing our own selves into that work. I love this concept of leadership is love. Leadership is about what we care about and showing up for that work. And, some days we show up more than other days, and that's a normal part of leadership, and how we think about ourselves as collective leaders in nursing, how we support each other in showing up for the work that is collectively important, how we back each other up, how we gather together to listen, how we think about what's the best way to go forward. So that's the work that we do, I think, very naturally in nursing and in midwifery. And, you know, we've got good guidance for that, right? We've got the Sustainable Development Goals, which really are, when you think about, you know, again, going back to that 2 loops, you think about what are we looking toward? I think the UN Sustainable Development Goals are really good, you know, I guess, streetlights. We're, you know, they're lighting the path for a lot of the things that we need to be working on and thinking about. So we're not, you know, we're not just paving, you know, making, you know, new ways of doing things. We've got a lot of wisdom and guidance that we've already collectively gathered that we can help to support and advance in our leadership and our education practice. So getting to the end of my talk, nurses and midwives have an intuitive understanding that human health is intimately intertwined with the health of all of our ecological systems. Being a transformational healthcare professional is the practice of becoming the future that we want to see, leveraging our own positionality, our own ingenuity, and our own leadership now, and showing up for this work of the great transition and the future of the healthcare systems and sensibilities that support the health and well-being of our patients and communities. In addition to all of that, how we care about the planet and each other and the environment and our healthcare systems is our stewardship. So we practice and move in this, you know, we always think of ourselves as like, you know, we nursing and midwifery is the practice of caring. Stewardship is a part of that, and how we think about this collective and beautiful home of ours. And this is a little bit of just a slide, what it looks like. There is actually a really interesting organization called Practice Green Health. Again, you can join that for free, but if you're interested in doing stewardship of your healthcare system and reducing waste, there's a lot of really good global resources for folks who are doing that work. And the Planetary Health Alliance, of course, I also have the slide. This is a picture I took on a trip to Cuba a couple of years ago, a local artist, Jose Fuster. But I loved this idea of as we are moving, like I think about following our heart path, the fact that this bicycle was parked right behind this tile heart. I was like, oh, this is, you know, following our heart path. Each of us has something or many things that we care about deeply. And I love this idea of like, you know, following our heart path in this image, just to remind us that that is the work that we are doing together. And I've put together so this is a QR code where you can pop into resources and references. I've gathered a lot of articles that I thought might be interesting for folks. So I'll give you just a minute to grab that QR code. And I can put the link in the chat for that as well. And that concludes my little talk.
I don't even have to give you the icons. I can just go like this in real life.
Oh, now I'm seeing the
both
chat.
of you
Thanks,
have trouble.
everyone.
Both of us have trouble in the middle of the night. That the side effect of coming on live when we should be sleeping.
Yeah.
So excellent, Heidi, and I've heard you numerous times, and it's just wonderful to hear you again as you bring it home for what it means for nurses and midwives to actually live into the planetary health vision and way of being. Before we open it up to questions, I do want to give you the lay of the land for the rest of the webinar. Block 2, you'll be sure you to check it out. That is where our sponsors have information about their programs and resources that they have. And so you'll want to make sure that you go into that Block 2 and explore around and take note of programs that you maybe want to follow on LinkedIn or other social media so that you start to build your network, that you begin to build your connections. And then block 3 is going to be fabulous. I tell you, the leaders of block 3 of Western Pacific region have been incredible. They have worked so hard to assemble speakers and experts in your region. So the first part of block 3 is going to be experts who can talk about what are you seeing in your area, in your region, that are indications of planetary health changes, followed by an opportunity to join various breakout groups. There's different options, and you will get to choose to go into which one is one that resonates for you. And again, packed full of experts from your region talking about programs, resources, and opportunities in where you live. And so I'm very grateful for the immense leadership and talent that is evident in the Western Pacific region. And I would be remiss if I didn't talk about this time of the Planetary Health Annual Meeting, which is our largest gathering of planetary health practitioners, experts, scientists, leaders, is going to be in the Western Pacific in spring of 2027. It's going to be in Tokyo. So start saving your pennies now, mark your calendars, sign on to the Planetary Health Alliance, and indicate that you're interested in the annual meeting in 2027 because it is going to be spectacular. And we hope to see you all there, and hopefully that can be live. We'll see you in person, and we can actually have a cup of tea. But now is one of my favorite times, and that is to hear from all of you. And so I have some questions that have been posted. If you have a question, just go down to the little Q&A button and put your question there, and we will answer it. So there's quite a bit of interest, Heidi, and I'm both of us will love talking about the two loops theory. So I'm interested to hear about two loops theory and if it might be a global trend, or is it something that's just localized? And what do we think is happening globally? Are we seeing this two loops happen? So I'll have you answer first, and then I'll jump in.
Oh, that's great. Yeah, you know what? I will pull in a few resources and I will pop them into that resources page. So if you all mark that spot, that I'll make sure we have a few more resources on the two loops theory. You know, it's interesting. I've been seeing there's a global community called Bioneers. I'll spell it out. And
I can do that, so you don't have to do that.
oh yeah, I got it. But there's a global community called Bioneers, and it's a community of folks who are working mostly in environmental justice. So it's not necessarily a health profession community, but they've been working a lot with this idea of two loops. It's a you know what I've learned about it. We were introduced to it by someone who studied under Joanna Macy, who's another environmental philosopher and theorist. Right. And so I do think it's something that's moving in the lexicon of how we're thinking about things. I will say it just comes in handy. I remember a conversation with my college-aged kid a couple of years ago who was devastated about what was going on in the world. And I said, well, here's where we're at. This is, these things are, this isn't the end of the world, right? Like, this is a process. These things are unfolding, decomposing, being composted. And at the same time, new things are happening. We need to pay attention to both, the unraveling that's happening, but also what's the creating that's happening, and that we have a responsibility in both of those domains right now as the people who are on the planet together in this moment in time. And it really resonated with my kid. This idea of like, oh no, this isn't the end of times. This is the end of one way of being and the creation of another way of being. So for me, that's a narrative that I think is useful when we think about having to show up for work that's really hard every day. And so that's kind of my response. I don't know what Teddie, what's your take on that?
I love two loops theory. One of the reasons is it comes right from nature. It's observing nature and understanding that systems in nature rise, grow, collapse, rise, grow, collapse. Nothing stays forever. Things are impermanent. And a lot of wisdom traditions acknowledge the impermanence of life. And so that two loops shows the system rising, growing, and collapsing. What's been happening is we keep trying to push it back. We keep trying to say, wait a second, we want it to go back again. We want it to be, in the United States, great again. We want to move it backwards, and that just is not going to happen. We've also said in healthcare to our nurses, just work harder, just be, just go through it. We can make it better. And it's working harder and becoming more exhausted is not the solution. So we're not going to make it go backwards. And this is happening globally. I watch trends, as Heidi said, I'm watching trends all over the world and watching little news clips and evidence of the system is collapsing. And that's multi-system collapse. So governance models, economic models, education systems, health systems, environmental systems, it is collapsing. Now, instead of being worried and wringing our hands and isn't this awful, you can choose to look differently, and you can say it is the natural evolution, and a lot of it's being hastened by human behaviors, but it's the natural evolution of a system. So let's find each other, let's work together to start to build the new system, to start to build what we envision for our children and our grandchildren. That's what the Sao Paulo Declaration is about. It is about starting to build that next system and finding each other. That's what the Planetary Health Alliance is about, is finding each other. So some people are natural visionaries. They work in the space of being a visionary. So they're collecting information and working in systems and seeing these trends. I tend to be that type of person. I'm sort of a visionary. Others listen to the visionaries and they're like, okay, I like these ideas. And they start to build the system. It's another role. The third role, and it's a very, very important role, and it's a role that nurses oftentimes resonate with, is it's a job to hospice out the old. It's actually called hospicing out the old, in that you help people realize, don't be afraid, don't be scared. I'm with you. I will walk with you so that you too can join the next loop. There's also a word in the two loops theory that talks about composting, that instead of just throwing everything away, figure out what's still beneficial, what's still useful, and pull it into the new system. Compost the old and pull it into the new. So it's a lovely model. It works really well. It is global, and it gives people a lot of hope that, now I get it. I'm not stuck with this broken system that's not working. I can start to be part of the new system. And I hope that that is what Heidi and I have been mentioning all along here, is this is a great time and reason for hope. Let's see. Another question here. Okay, looking at people who are looking for universities that offer specialty in some of these areas. So Ray and the planners of this conference have done a beautiful job doing outreach to our sponsors, and that's why I really want you to connect or get into the room, walk down the virtual hallway into the exposition hall of our sponsors, because that's where you'll learn about programs that are focusing on planetary health, that have programs in sort of the One Health space or the planetary health space, and you'll find allies there. Heidi, do you have additional comments you want to make? If not, I have a question for you.
Yeah, no, no more questions. Yeah.
So my final question for you, and you can feel free to pitch one to me too, is every time I give a talk, people say, "Why are you hopeful?" And so I'll ask you, Heidi, why are you hopeful?
Oh, it's interesting. I'll say the answer. I'll bet I'll have a different one all 6 times that we do this, but I think it is really innovative and cool that the Nightingale Initiative for Global Health, when we reached out to them about integrating planetary health into the work that they're doing, that it resonated so deeply with that organization, and that we ended up coming up with this crazy plan to do a global conference, and the numbers of nurses that have come together to present on the work that they are doing. So I am hopeful this is the first, I don't know if you all know this, but this is the first of 6 around the world that we're doing this week. And I am hopeful because I am excited to hear about this community a little bit more, and find new friends. And how about you, Teddie? Tossing it back to you. How are you hopeful?
Well, I'm hopeful. We got a question from Muhammad Umar, who said he's from Pakistan. And Pakistan is very, very impacted by environmental harms that are being caused by humans. And the people of Pakistan have not necessarily contributed to causing those harms. So I want to acknowledge that I am so sorry for your nation and your region that is impacted so horrifically, especially recent, floods that have caused great harm. I want to lift up Dr. Hina Shah, who is from Pakistan, a medical physician and very involved in the planetary health movement. And so I celebrate the work of Dr. Hina Shah from Pakistan. I hope you're able to meet her or connect with her at some point, because this whole event is about people making connections, about networking with people in your region. And so that's how we get moving. That's how we build this movement. So why am I hopeful? Because people like Muhammad in Pakistan are asking about how can I get connected further? That's what this is about. It's not about one of us, it's about all of us doing whatever we can to move this whole system back towards health. That is what nurses are good at. We move systems back towards health. We also help people die with dignity, but we're not there yet with the earth. We're not giving up on humans. We will always choose the earth, and we will always choose one another. So I'm going to close out this block, this session, and again invite you to join block 2, see what our sponsors have to say, and please do not miss block 3. I will be there soaking it up to learn from your experts and what they will be sharing. Thank you very much.